Hello, my name is Kay Aubrey Shemaine, and I am the director of Photonic Therapy Institute, your host for this Independence from Pain Summit. My guest this session is Dr. Kent Hungerford from SouthCoast Foot Surgery in Wollongong, Australia. Dr. Hungerford uses laser therapy as an adjunct to podiatric surgery. He says he wouldn't operate without it. Laser therapy is critical pre-surgery, post-surgery, and to help his patients avoid surgery. Welcome, Kent.
Thanks, Kay. It's really great to be here.
Well, thank you for joining us from all the way from down under. Tell us about your practice. Would you just explain to us a little bit about what you do?
Yeah, so I'm a foot surgeon. I've specialized as a podiatrist in Australia into the area of foot surgery. So a lot of what I do is helping people with foot pain, and in particular pain through bunions or hammer toes and heel pain type concerns. I do a lot of minimally invasive surgery, and that sort of complements what I'm doing with my laser therapy, because we're really about decreasing pain and decreasing time off our feet so that we can get back to our normal life as quickly as possible. From that, I've been using laser therapies for about 5 years, and they really help to augment what I'm already doing to get my patients moving a little bit quicker than what they may otherwise be doing.
Great. So as a foot surgeon, I'm going to avoid podiatric because I know I'm going to mess that up at some point. As a foot surgeon, how do you explain laser therapies to your patients? Like when you're saying, I want to do this, how do you explain it?
Yeah, it's a really tricky thing. And, you know, I'm a big one for patient education. And that's why I jumped at the opportunity to jump on board with this conference and the talk today. Because, you know, a few hundred years ago, laser therapies would have been called magic.
Mm-hmm.
You know, we would have been witches and wizards. But these days we know that we've got science and a fantastic body of evidence that's really showing us that we can increase the ability for our body to make energy. And energy at a cellular level is great because those downstream effects can increase our healing rate, decrease swelling and inflammation, but most importantly for our patients, because it's something they feel, it will decrease pain. We need to think about it as being something that will enhance our natural healing ability in the same way that we look at photosynthesis in plants. And as we know, photosynthesis is about putting the light from the sun in to enhance the ability for plants to grow. For us and for laser therapy, to me, it's all about getting the right spectrum of light, the wavelength of light at the right intensity for the right duration. And when we see that happen, we generally see some really magical things that decrease pain, that increased healing.
When you first started your practice, did you use laser, or is this a new change? How has it changed your practice if it's new?
Yeah, so when I first heard of laser, it was sort of through a colleague initially, and they were sort of very hesitant about it. Thought it was again, you know, too good to be true, so it couldn't be true. And that sort of then made me have a bit of a look at the evidence. I then jumped on board with a colleague working with her business. She really introduced me to the wide world of laser therapies, and it completely revolutionized how I practice. And, you know, like you've said there in the intro, Kay, I wouldn't operate without it, whether that's pre or post surgery or just to completely avoid surgery. And I'm seeing more and more in how I refine my practice methods with laser therapies, that we're really able to avoid surgery more often than maybe what we could have or were doing previously. So
That's
it's something
awesome.
that has definitely revolutionized what I'm doing.
Are you using red, infrared, polychromatic, a combination?
Yeah, so the device that I use is a red and infrared. I use a base station, or what I call a base station in my office, which is quite a high intensity laser device. And with that, you know, it means that I only really have to do it once or twice per week for the patients. However, there's definitely options that I offer to patients in the way to be able to do this at home, and particularly in that post-surgical area. It's really important for patients to be able to do this at home without having to move around on their feet as much. And so we deliver that as a pad with LEDs in it, infrared and red light again, which really helps to increase the healing, decrease the swelling, particularly in that, again, surgical side of things.
Well, that's brilliant. And you know me, I'm all about empowerment and helping people to do this at home as well. Um,
Yeah,
so you're primarily focused on the foot. What do you
that's
treat most commonly and how do you treat it?
Yeah, so we see a lot of different things within the foot, and sort of expanding from that, heel pain is probably something that podiatrists or foot physicians see most often. Heel pain, whether that's commonly known as plantar fasciitis, but a whole other different types of heel pain can be caused, as well as sort of nerve entrapments, laser therapies for nerve entrapments. I just find to be phenomenal. It's a hidden gem. Where medications can't touch some of our nerve conditions. I'm finding that laser therapies revolutionize sort of what we're doing there. Other different concerns such as arthritis and inflammation, compartment syndromes, which is, talking about abnormal pressures within our muscles and cramping. But previously I have treated right through up to the knee, and particularly with sciatica. I have really good response with laser therapies. When we talk about sciatica, obviously pain through the lower back,
Right.
lumbar area, that can then go down to our feet. And so I think as a foot physician, I can't confidently resolve your foot pain unless I'm going to be treating a little bit more what we call proximal, or further up the body there, where that nerve pain's originating from. And we have great response to that.
Well, okay, so one of the most common questions I get asked for those people that get torches or pads is about plantar fasciitis.
Yeah.
And so what would you say to someone who's a client who comes in with plantar fasciitis and they have a light therapy device? How would you, or what kind of protocol would you give them for addressing that?
Yeah, so for me, diagnosis is key. And so plantar fasciitis is a very common condition that's diagnosed. And I'd probably suggest that there'd be a good percentage of those that may be misdiagnosed. So diagnosis would be the first point. If it
That's a good
is going to
point.
be, yeah, that's it. And, with laser therapy, it doesn't distinguish what the type of tissue is. And so that's fantastic. For all concerns, it will definitely help. But it definitely will help with our complementive therapies, which way we're going to target that in addition to the laser therapy. For me, a treatment regime for heel pain is really dependent on what the patient's pain level is and how much it's impacting their day-to-day life. Generally, the first point of call is laser therapy, putting some inner soles or customized orthotics under their feet, which would redistribute the pressure. And then I do a lot of injection therapies. So I'm doing less and less cortisone or steroid injections, and I'm doing more and more local anesthetic, or what I call hyperdilatory local anesthetic injections there. And that just sort of resets those pain stimuli, using a few of the pain science mechanisms and theories there too.
So you're
Further
not
on
sending them
from that,
home with just roll your foot on a bottle of ice, which is what we hear a lot.
that's it. Yeah, I'm not an ice roller at all, actually. I do some of our strengthening exercises for some of our small muscles within our foot, but I generally take quite an aggressive approach when we're looking at heel pain, because, without throwing everything at it, it's really quite a tricky one.
And
Yeah,
yeah, it affects everything. You can't get anywhere. You can't go shopping. You can't do your dishes, as it were.
that's
Um,
it.
okay, so you want to give me some examples of how laser therapy has helped some of your individual clients? Maybe some case studies you could talk about?
Yeah, absolutely. I think, well, why don't we start at heel pain? Because it's obviously something that everyone feels a lot of. The typical patient that I'd see with heel pain, maybe a male or female that's on their feet a bit more, maybe slightly overweight, and in their sort of 40s to 50s generally. And we generally will find that they'll have pain on the first few steps in the morning. For this patient coming in, they'll be sort of saying, "Yep, I'm ready to have it chopped off," and be in so much pain that they're just wanting any option available. For this type of patient, again, diagnosis is key, and so whether that's undertaking some ultrasound or X-ray imaging to see that it is actually what's happening there and we're not missing anything. Maybe the first start point there. Whilst we're undertaking that though, again, I'll usually treat on my first consult, and that would generally mean that I'm putting some laser therapy into place, as well as something for their shoes. And if their shoes aren't appropriate, getting new shoes. But, then that may expand into inner soles and custom orthotics that I'm looking at, and injection therapies as required. When we talk about laser therapy and the device that I use, I'll generally say that they may initially have a bit of a spike of pain. And I sort of put that down to increased blood flow in the area and not getting rid of those bad inflammatory free radicals from the area as quick. That may last, if it does happen, just for the first 24 hours. And then patients will generally wake up the next morning and say, yeah, I had a little bit less pain. When I review them, they say, yeah, I did really well. I had a great week and I'm in so much pain now because I maybe pushed it too far. And that's typically what I will see when I'm seeing patients for that second time. But when we then get through to a few different sessions, put in a few of those complementive therapies in place, we're going to be generally seeing a decrease in pain much quicker than what we'd see without laser therapies. And generally we'll find that it'll be quite decreased within that 3-week period that we're undertaking laser therapies. I generally would look at once to twice weekly for 3 weeks as a treatment regime when I'm treating in that way.
Do any of your heel pain patients, do you have any benefits from that with the sending home a pad, or is that usually something you do just for surgery?
Yeah, at this stage, it's something I'm just doing for surgery, but it is something that I'm sort of moving into a bit more. And previously, when I've used those type of devices, it has been fantastic. It's a little bit of an upfront cost, of course, but then, patients will find that benefit in, being able to live a lot easier and have less pain during their activities, which makes them more productive and, very quickly paying off that padding dividends from having a more happy and social life that way too. Yeah.
And what other type of case studies can you talk about? Besides heel pain, what other things are you doing?
That's it. So another one that I do a lot with and really, really enjoy just because of the ability to resolve pain is just nerve pain generally. Now this may be nerve pain that's causing heel pain, or it may be nerve pain from entrapments and arthritis over the top of the foot. And one case that I'm thinking of in particular was a gentleman that had post-surgery, had a few screws break, and these were causing a few entrapments. They weren't in a position to have these taken out. And we undertook some laser therapy, and that was the only intervention we did. And this pain was chronic. He came to me from another colleague, and we undertook 3 lots of laser therapy within 9 days. And he came back after the 3rd time and just said, I've got no pain at all. I'm happy to stop treatment now. And, for someone that had been in, quite chronic high level pain for quite a while, this was, something that I could offer in a very short period of time with no surgery to completely resolve that pain without medication. So I think those type of patients really make it worth it, and really mean, as health practitioners, as the public generally, we need to start sourcing and seeing how these sort of therapies can really help.
You said something key. One of the last things you said, and that was without painkillers, right? If we can avoid the opiates, if we can avoid the NSAIDs, and we can avoid the damage to the liver, then that's so key right there. And now that we're seeing so many other, light up the foot, we may be getting benefits in the brain. We may be getting benefits at the heart, the cardiovascular level. So there's no downside to wherever you're going to put that light. But doing one of the huge upsides, of course, and why we called this summit Independence from Pain, was just the opioid crisis is worldwide. This is something that affects every economic level, every social level, every caste level. So if we can find a way to do it that doesn't have the pill as the fix, right? I think that's great. Yeah.
That's it. And it's a really big thing that I look at. And I'm going to talk a bit of science here now
Go
because
for it.
a bit of research, because it's really fascinating when we start looking at some of the research coming through around this. There's one of the theories which is mitochondrial drift, where we are applying a laser therapy, say, to the right foot, or this is actually research on right arm. We're finding that the mitochondria, which is our energy producing cells, are allowing that drift or movement of increased energy to then go to the other limb, being the left. So although, like you say, we're applying it to one spot, we're then getting increases in healing rate of the other side. And so we then go further. I know one of the other studies that I've really enjoyed and looked at different things, and I'd almost love to do my PhD on it if it was possible in the small amount of time that I've got, is around increasing stem cells through applying laser therapy to the tibia, which is your lower leg bone. The
Well,
tibia,
you're talking to an acupuncture geek, and that point that they're
yeah,
lighting up at the tibia and fibula is a
that's
spleen
it.
point for acupuncture. And of course, spleen is where our stem cells are made. So I find the correlation between that to be brilliant.
That's
So,
it. And so we know that tibia being a big long bone is going to, help produce more stem cells. We can get it straight into bone marrow. We can then start seeing where that's going to affect. And I've always thought, if we're able to increase stem cell production, which we know decreases scarring, why aren't we potentially putting these laser pads onto patients' lower legs when they're on the
right.
way to the hospital with a stroke or a heart attack? For that preventative side of, preventing heart
What a great
tissue
idea. I
damage
hadn't,
and being, preventative from an initial standpoint on the way to hospital.
I hadn't even thought about that application of it. That's brilliant.
Yeah. So, there's a lot to go with the research, but I think when you start thinking, okay, yeah, we can start stopping deaths from heart attack and the longer term health concerns from strokes, whilst they're initially diagnosed on the way to the hospital anyway, that just really, it blows your mind what we're looking at. And, I come from a foot perspective, that's not necessarily my area, but you can really see where we can then adapt it into the future. And again, stem cells are the key to healing. So I think there's a real big area there that can be explored in the years to come.
And stem cells without all of the religious or moral objections of fetal stem cell production lines, not to mention the scientific difficulties of maintaining those lines, or the genetic uniformity or any of the other problems with that way of doing stem cells. If we can produce our own,
that's it. We're enhancing what we've already got available to us. And, we're doing that in a safe, as you mentioned, without a pill. And it's a way that we can really amplify the body's own healing rate. And again, that photosynthesis, it's natural. People won't be in pain from having laser therapy. And that's where, there's a lot that we can capitalize on there.
I can see a time when photobiomodulation is just set right beside photosynthesis and explained in high school science, right? This is done in the plant, this is done in the human. Now you've got my brain thinking about a cuff to go around right below the knee on every, emergency patient in the ambulance.
In the ambulance, yeah.
The stem cells, the increased circulatory, the lymph opening that you would get in that location. Of course, and if you did it right, it wouldn't matter that they'd have pants on. We still get benefits through cloth. That would be great.
And the ability to be able to roll that out easily is really straightforward. You're just placing a pad quickly underneath the legs or over the top of them on the way. It won't impede anything as far as getting some lines in for fluids or medications. There's really,
well, they're also doing, I saw a study where they were also releasing stem cells by lighting up the last ribs. Okay. Yes. And so even easier, throw a pad right over their belly, right on that last rib, you're going to open up cardio. Oh, see, now you got me just going on a whole different
Yeah,
area.
that's it. There's just so many options there. And, we're already seeing devices that are, potentially with patients with our heart attacks that are doing the compressions. Why can't it just be incorporated into the bottom side of that? It's already on the chest and it would cost
Right.
no more when you're looking at those sort of things. So, it's really just about thinking about these opportunities that are available. I know there's a few surgeons here in Australia with sort of looking at those laser beds that are around, and there's a few different types that we're seeing. And there was even a dentist in Brisbane, sort of in the northern northeast of Australia. They're having their patients jump into one of these laser beds before going into surgery. So they've got it in the waiting room, sort of pre-theatre. They jump
Just
in
an
there before and
FYI,
after surgery.
yeah, for short people like me, don't try to get in and out of one of those beds without help. It doesn't work.
They're very
They're making me
difficult, aren't
difficult.
they?
But yeah, they're
Yeah, and
brilliant.
especially after 20 minutes when you're feeling really relaxed and you could almost be falling asleep if you haven't already. It's I've been there, Kay.
Yeah.
They
I
are
got very
amazing.
relaxed. I got very relaxed.
Yeah,
And
that's it.
yeah, those beds, it just for the sake of our listeners, most of them are not LED, not laser, they're LED. It's just a term for light. Don't get all upset. Whether
Yeah,
it's
and
laser,
yeah,
LED, yeah.
that's it. And they're
So
the type of bed that you are jumping in there, and you don't need glasses. There's no concerns.
exactly.
Although they look like one of the old school tanning salon beds, they're very much not, and they are completely safe. Like all of the lasers and LED red lights that we're talking about here.
Right, right.
Yeah.
So, um, how do you see laser light therapy, photobiomodulation changing and expanding in your industry, in your section of surgery and foot care?
Yeah, so I do think that'll become a standard practice that all physicians, practitioners are using laser therapies as part of their treatment. I think it'll be much more acknowledged, and we'll have guidelines that are saying, this is our first option when we come to laser therapies, because it is a pain-free, non-medicinal or pharmaceutical option there. I think when we can enhance the healing ability of the body, there's no way that it can go backwards. I also do a lot with what we call high-risk foot patients. So they're patients with diabetes or other chronic diseases that develop foot wounds. And we have some really good guidelines there that are sort of showing that we've got some really good evidence there that are showing that we can increase the healing rate of these ulcers, which will decrease billions of dollars spent on healthcare in that area. And we're just waiting now for that evidence to build up further so that that can make it into our international wound guidelines, which then recommend to our hospitals what we need to start focusing our funding and our practice on. And I, working within that industry at the moment, get very frustrated that we can't offer this as an option at this stage, as we still wait for that body of evidence to grow. And, when I talk about a body of evidence, I'm talking that we've already got over, 5,000-6,000 research articles, and
Right.
over 500 of those are, really high level evidence, being randomized controlled trials, and then reviews of these in what we call systematic reviews and meta-analyses. And when we get all that evidence together and have our world-leading experts comb through that, I feel that we're only several years away from then having that rolled out in that arena as something that's standard practice.
It's interesting. There's a disconnect between the world research level, researchers, and the medical facilities, and then the average therapist, right?
Yes.
And the medical industry is just now really seeing the benefits of a massage therapist, even a physical therapist. That was just, that was the side. It was not. And now they're seeing, maybe there's a lot to that. And I know that at the WALT, the World Light Therapy meeting, I talked to many, many researchers from around the world who didn't even know that there were light therapists that did this out of their office, just like a massage therapist would. And they were shocked. So what we're trying to do is get light therapists to document their sessions so that they can be submitted for review, for tracking. Look, we know how much light. You're using a device, you can count how many seconds you're using and how many, joules of light you're providing and how often did you do it and what results did you see? Because Dr. Hamlin, when I talked to him, I said, how is it that when we do it, it's anecdotal? But when that veterinarian over there gave me their single off, one off, oh, look what happened with this dog, his was considered non-anecdotal. And he said, because I could measure it, because he could tell you exactly what he did and how much. I said, great, we're going to do that. So I think you're going to see more of that coming out of, it doesn't have to be at the university level. We'll be starting to submit that at every level. And that's going to speed things up too.
Yeah, that's it. And we need to really dispel that myth of, you need to be at a university to do research. The average person can undertake research, and there's all these resources around to be able to start that option. And I think, and again, one of the reasons why I'm here is to start the conversation. We need to get that research out there. We need to increase that public education and the public acknowledgement, but broader than the public, we need to have our doctors and our physicians and our surgeons, our practitioners, our physiotherapists really coming on board and realizing the potential that's available here and having that conversation through to them from a patient level and from myself, spreading the word like I am today and having more of these opportunities to just have a nice chat about it.
25 years ago, I started with my first red light therapy pad. Little red pad, red diodes, they pulsed on and off and had amazing results for a horse that 3 vets said, put it down his hamburger. Yeah. That was and so I started working with it and I started using it and I started learning more about it. But for 20 years, that was alternative therapy, that was holistic therapy, that was energy medicine, that was sneered upon. And it's so exciting now to see that every year we have a snowballing amount of research coming. We have greater and greater visibility across the world. And we have things like this showing up. We're not the only ones that'll end up doing a summit. There's one recently on brain, on working with the brain with light. Yeah. So
isn't that fascinating stuff? And, I think you're sort of alluding to, our Alzheimer's and Parkinson's. Mm-hmm. And I just look at that and I just go, if I were to have any concerns in that area, laser therapy would be where I'm turning first. And because it's safe, you're not going to do any damage, nothing lost, and potential amazing things won.
Amazing things gained, exactly.
That's right. It's just a really an area there. And like further to that research, we're talking, and again, I'm going to, bring a bit of research and science into it because some of these statistics are fantastic. And when we talk about tendon healing, which is a big part of the foot, whether that's the Achilles tendon of the calf or whether we're talking about some of our other tendons that support us when we're having an ankle sprain, or even a tennis elbow, there's literature around that's equivalent. And it's showing that we're having about a 70% increased healing rate when we're using laser therapy in conjunction with our standard strengthening exercises. So yes, we are still using those strengthening exercises, which is standard practice. And then we are then augmenting them with the laser therapy to further increase that healing. And again, with wound healing in patients with diabetes, we are then able to increase the wound healing as measured by the wound diameter and healing rate by about 70%. So we can almost heal in, 2/3 the time. And that's just phenomenal, increase to a patient who's, really socially isolated, likely having quite a lot of psychological concerns related. And that's before we even start talking about income loss to them or the burden on the healthcare system.
Yeah, or the burden on their family members.
That's it. There's so much within that area.
Paige Roberts is another person who's speaking on this, and she works with issues of the brain, whether that be Alzheimer's, dementia, traumatic brain injury, sports, concussions are a big thing in sports industries.
Yeah.
And we talked about how many sessions do you need to do to think about having recovery. And she gave examples of somebody with, if you had somebody chronic Alzheimer's, maybe 50 sessions, 3 times a week. Well, if you think about that, that's not very many.
Not at all.
You,
That's
if you know,
incredible, isn't it?
if you had a session at home, if you had a system at home and you were doing 3 times a week, you know, in less than half a year, you might have a huge change and almost a full recovery in some instances.
That's it. You know, those sort of things, it's going to be the future of health, and can't wait to see some of that research coming out to show, yeah, this is actually working.
I know a lot of the big Alzheimer's, Parkinson's research is coming out of Australia. There's some brilliant stuff coming out of there. So
well, we've got a few. I don't know whether you've got them over your way, but we've got a few what are called men's sheds where, you know, some of the older gentlemen within the communities will go together and try and get rid of some of that social, you know, exclusion side, come together as a group. And one of them in Tasmania, our smallest state down the bottom, they've come together and looked at the red light buckets, and they're using buckets on their head with lights in them because it's cheap, cost effective, and helping people out that way. And I just think
they're just doing strips of LEDs in a bucket. That's right.
That's it. And that was just a grassroots sort of area, and now they're finding really good results. And like you say, that's where it starts, and that's where we're going to see some of these great things come from as well.
Yeah, if you people are scared about getting started, and do I think there's a difference in quality in different equipment? Of course. Are you going to get faster results with better equipment? Maybe, if you use it. But if all you can afford is just something that's a $50 red light, you know, infrared lamp, start there. Get going, right? Get the circulation going, get things going, and then move up, right? Obviously, a practitioner needs something that they can use over and over and over and over again and have consistent and trackable results for research, et cetera, but just get started. So, okay. I had another question for you and I don't remember what it was. Did you had more you were saying about research?
Not too much more on the research. I just think from a podiatric surgery, a foot perspective, there's really a lot there that we can tap into, and I really look forward to seeing what comes from this conference, another conference like that, to really start that discussion around, you know, what different devices are around. You know, I use myself one that can be sort of strapped onto a foot and self-times it for 20 minutes and then turns off. And that's quite effective. That's used twice per day. But then, you know, as you're saying with the research, a lot of that is around, you know, something's better than nothing. But what we call the dose rate, which is, you know, how powerful for how long and how often. And then, you know, the wavelength of that light as well. That's where a lot of the evidence has fallen down for us, because it's taken researchers a little while to find, you know, the optimum dose rate. And now that we're seeing that has been a little bit more refined, we are finding that within that spectrum and intensity for the right duration, we are finding amazing results from that. And
your friend Michael Liner is doing a presentation on the gamut of different, and he forgot to show his own.
It's going to play into it really, really hugely. Yeah. So there's so much there, and not to be disheartened, because I know there's some people out there, practitioners as well, that are sort of saying, no, it doesn't work. I read this article, and when you go into it, you can really say that, yeah, okay, this is what we're actually
looking at. It really does. Yeah. And I think, and I had this conversation with Michael Hamlin as well. People, they'll read something about a biphasic dose response, or that, oh, we didn't get response because it was too much. In my own personal opinion and experience as a practitioner has been, of course, the sicker someone is, the slower you have to go. If you give the whole body a bunch of energy all of a sudden, and it starts detoxing and every cell has the energy to do its job, you can overwhelm the body. So I start slow. I start with the, you know, the lymph system and opening all of that. But people, I will have practitioners say to me, oh, I don't know. It's too, like you said, too good to be true. It's magic. It's too good to be true. It's like, you have to sit down and work with it. You can't try it on just one client. You have to sit there and look at it and think about what it is you're lighting up, right? You're a foot surgeon. You're not going to go light up the elbow to help this person, right?
Yeah.
You're going to have to put a plan in place and talk to those who have used the plans longer. And then, well, yeah. And unfortunately, I know a lot of physicians that I've talked to, dentists that I've talked to, chiropractors that I've talked to, they may have bought a $25,000 system and gotten little or no education in how to get good results from it.
And that's the critical bit, you know, even after 5 or so years, I'm still changing how I practice with laser. And, you know, like you're saying, too much of a good thing's a bad thing. And it's really about slowly increasing that into the right level. And, you know, it may be that you're increasing that each time you see them, and people will respond well to that as well.
And yeah, are they hydrated? Do they have a good diet? Do they sleep well? All of those things play into it. So not to get disheartened when one session didn't fix everything. Yeah.
And yeah, I think, you know, and to me, laser therapy is definitely a complementive therapy. A lot of the time it can be used by itself quite successfully. But when you really want to see something amazing happen, we really need to, you know, come back to our, you know, tried and tested original treatments and using them in conjunction with the laser therapy. There's a lot of stretching and strengthening that I do with my patients to get them into a good position with the laser therapy, just to enhance what we're already doing. And that's where I think, you know, that's when we cut down those months to weeks, and those pain levels from 8, 9, 10 down to 1 or 2 quite quickly.
Awesome.
Yeah.
Anything else you want to say to our audience?
I think we've had a really good chat about it all, actually. I think, I just sort of would suggest, you know, there's a lot of people in pain, irrespective of where that pain might be coming from. And laser therapies, to me, is a really big part of how that works. You know, we're seeing a lot at the moment myself within the health arena around some of these medications. And I'm sort of thinking opioids as much as I'm thinking now pregabalins like Lyrica that are being used a lot in nerve pain. And I just find laser therapies are really cutting through some of that pain that even some of these medications aren't doing as effectively. And so, you know, I would, you know, you get out there, see who's local, see who you can really use to try and help you with your pain journey and bringing that under control.
Excellent.
Yeah.
Well, thank you so much for spending time with us, Kent. I really, really appreciate it. And I think we're done. Thanks, dear.
Thanks, Kay. Really appreciate your time. Cheers.